Start.
Okay. Hi, I'm Dr. Iftikhar, one of the doctor in the ward today. May I confirm your name and age, please?
I'm Hannah Clark, 25.
And how would you like to be addressed?
Hannah's fine.
Okay. How are you doing, Hannah?
Fine.
Okay. Hannah, let me tell you briefly what we will be doing in this consult. I'll be asking you some questions, and we will discuss about your management plan. What do you think about it?
Yes, doctor, go ahead.
Okay. So, Hannah, I understand that you had vaginal delivery and you had a tear down below. Is that correct?
Yes, doctor.
Okay. So, tell me more. What's going on?
Doctor, I'm delivered very rapidly, doctor, in the hospital. Just while in my home, I feel cramps in the lower part of my tummy, and I will go to the hospital. And surprisingly, the midwife examined me, tell me I am fully dilated, and I'm surprising also I am delivered since 30 minutes. So everything go fast, doctor.
Okay. I'm so sorry that you have been through this difficult situation, but I'm here to help you and support you. How's your recovery going on, Hannah?
I'm fine, doctor. What do you want to ask me exactly, doctor?
Any pain?
What?
Do you have any pain?
Now the midwife gave me painkillers. Now I'm fine.
Okay. Any foul smelling discharge from down below?
No.
Okay. And are you taking any medication for any laxatives to avoid constipation?
I think it is written for me, doctor.
Okay. Are you up and about and moving?
Yes.
Okay. Are you breastfeeding your baby?
Yeah.
Okay. Any problem with peeing?
Any problem with what?
With your waterworks or peeing?
No.
Okay. And okay. And are you eating well? Are you passing flatus?
Yes.
Okay. And any other problems with after the delivery?
No, doctor. Just I'm afraid that why this happened with me, and it can be happen again in the future pregnancies.
Yes, so we will be discussing about that shortly, that there is still a possibility of having this tear in future pregnancy. I know you've been through a very difficult time, but we are here to help you. And just some more question. Any problem with your stool, any incontinence or anything?
At the moment, no, doctor.
Okay. Have you ever got pregnant previously?
No, this is the first one.
Okay. Congratulations on your first baby.
Thank you.
Okay. And what about your any medical condition?
No.
Like high blood pressure, clots in lungs and legs, or diabetes, anything?
No, I'm fit and well.
Okay. And any allergies?
No.
Are you using any medication for a prolonged period?
No.
Okay. And are you aware of your height-weight ratio?
I'm not sure.
Okay, that's fine. Okay. And what about who do you live with?
It's my husband.
Is he supportive?
Yeah.
Okay. And what do you do for a living?
I'm housewife.
That's great. Any low moods for 4 or more weeks?
No.
Okay. Anything else you would like to add?
No, doctor, I'm afraid about this, why this happened. I think, doctor, the midwife is not competent, doctor.
Okay, I'm so sorry to hear that, Hannah. So I want to assure you that all the staff in NHS are well trained and competent, but there are certain circumstances that complication do arise. As you mentioned that your delivery was happened very quickly, so that could be one of the possibility. You know, like if you deliver in the hospital or in midwifery-led care on home, if it's the birth is supervised by healthcare professional, you know, we keep on monitoring you. But in these circumstances, unforeseen circumstances can happen. I know it's very difficult, but you know, we are here to support you. And for your pain, we will give you painkillers, we will give you antibiotics for your better healing, and for also I would like to tell you that in your future pregnancy, there is still a risk of like 5 to 7% of risk having this tear in future pregnancy.
So what can help me to recover, doctor?
Yes, that's what I'm going to tell you. So for your recovery, you have to be up and about, just take healthy diet, high fiber diet, and then also try to avoid any constipation, because it can worsen your condition, and it can also affect the wound healing. And we will connect you to our physiotherapist. He will help you in pelvic floor muscle training, which will strengthen your pelvic floor muscles. And also and if you have any signs, any smelly discharge, any problem with wound healing with your stitches, or any excessive pain, or any fecal incontinence of stool, you have to come to the hospital right away. Okay. Am I clear so far,
yes.
Hannah?
Yes, doctor. Very clear.
Yeah. Yes, and we are here to help you. And also, if you have more questions, you know, we're here. And I would also like to let you know that 60 to 80% in 1 year, they don't have, in next 12 months, they don't have any problems. Only if you have any problem with your stool incontinence or something, then, you know, like we can always refer you to a specialist, colorectal surgeon.
When you can come back to the hospital?
You can come back in 6 weeks, and we will have a follow-up for you to see like how the things are going on. But in the meanwhile, I'll refer you to the physiotherapist, and also keep on breastfeeding your baby for contraception. You know, I'll connect you to contraceptive clinic, have safe sex practices. And I'll give you this written information to read, and also I can connect you to support group who have been through similar experiences. You know, you can share your experience with them, and maybe you feel better. And if you feel that, you know, you're not mentally feeling well, I can also connect you to our clinical psychologist and mental health counselors.
Okay, when I can do sex, doctor?
So sex is it is on individual basis. Usually when you're completely healed and when you feel you're ready, you can go for sex. And usually, you know, it takes 4 to 6 weeks. But if you're ready before that, if your wound is completely healed, if your wound is completely healed, then you can go ahead with it.
Okay, thank you.
Thank you. Any questions for me?
Yes, you are dead well.
Okay, thank you.
But let me to review the domains with you one by one.
Yeah, sure.
Okay.
Sure.
So regarding with the communication with the patient, now this patient, you are in the hospital in the postnatal ward, and you are coming to the patient. Okay.
Yes.
So the approach different than when you are in the clinic and the patient came to you. Okay, so it is better to now the patient in the hospital. So first, hello, this is Hannah Clark. I am Dr. Maria, one is Dr. covering the clinic today. Can I confirm your age, please? This is better than as the case you are in the clinic and the patient came to you. In the clinic, yes, you can start. I can confirm your name and age, please. Dr. Okay. So, but here, start by this is Hannah Clark because the patient in the hospital. Okay. So first, Next, after telling that and the incident and introduce yourself and what report to the patient, so the confirm of meeting understands that you had vaginal birth and during it you have had a tear, and I'm here to discuss with you. And then followed by, you must apologize.
Yes.
This is when the communication to the patient, apologize for what happened.
Yes.
Okay, I'm very sorry to that happening with you. I know that it is a difficult time for you. I'm immediately reassuring the patient that I will do investigations in the hospital to search about why this is happening with you, what we call incidence report, and when the results are released, I will discuss with you the result and to know why this is happening with you.
Okay.
Incidence report is very important to tell the patient from the start.
Okay.
Okay. Then very important to ask with every task what is the expectation and the concern of the patient. You don't ask me what is the main concern. I will tell you voluntary, but I want from you to ask the role player after introduction and after situation awareness. I understand that you had vaginal birth and during it you had tears. So, and apologize, and then so you can tell me what is the main concern, what is the main expectation from this 2D meeting. So I will give you all the information. And after that, this happened again. Why is this happening with me?
Okay.
But by this information, the dialogue and the consultation around all of these points. So you know the main concern and the main expectation, very important. And then you are take much time for history. If you say we need relevant history. Relevant history, very important about the recovery. Don't ask a broad question, what about your recovery as a role player? Now you are delivered, yes, everything is okay, you can go to the toilet easily, any problem with bowel ward, any bleeding from down below, any discharge, you are breastfeeding your baby, you are named your baby, excellent name, lovely name, okay? It's very important as related to the communications. Then
Yes.
after that, target history, do you get pregnant before or no, and the mode of delivery. Target history about the obstetric history. Important to ask about the mode of delivery and the weight of the baby.
Yes.
Don't ask me about the weight of the baby. This is breastfeed labor. In particular, if the baby weight is 4 kilograms, for example, so it is a breastfeeding factor for tear.
Yes.
Okay, this is regarding to the information gathering. It will take a lot of time. Yes, you ask about everything.